This segment of the news is brought to you by Sun Oil Limited.
Reports that the government has ceased its aggressive pursuit of illegal immigrants couldn't be further from the truth, and that's what Press Secretary Anthony Newbold's reporting, adding that there's no reason, to think otherwise.
The minister responsible for immigration is dealing with that, and the Prime Minister said, listen, if you don't come in, if you don't leave or come in and present yourself, you're going to be aggressively pursued. That is still happening. So if it hasn't changed, they should just stay tuned.
Now, as to what was anticipated that the government would do to move along the process of those that made applications for permits or status, Mr. Newbold had this to say.
According to the minister responsible for immigration, that has been done. And they are dealing with, is it at the level where it ought to be? Probably not. But according to the minister, they are dealing with that. And, we say what we want, and it happens and everybody gets upset. I'm sure you will be hearing some more from the Minister of Immigration.
Mr. Newbold could not confirm whether strategies of the aggressive pursuit has changed, but said those who are illegal should concern themselves with becoming legal or leaving the country. The U.S. has made much about supposed crime-ridden areas here in the Bahamas, but while there's been backlash in the face of it, a cabinet minister contends that, to a certain degree, Bahamians are to blame for how the country is viewed. JCN's Jillian Gray has the story.
It's the sensationalizing and focus on negative stories that may strike fear into the hearts of tourists coming to the Bahamas. So says Tourism Minister Dionisio de Aguilar, who responded to the U.S.'s travel advisory warning its citizens not to come into the over-the-hill community or down to the fish fry. Unwarranted or otherwise, the U.S. said a mouthful about the Bahamas in its latest travel advisory, but the minister wants to make one thing clear. Compared to other countries, the Bahamas is relatively safe, and those at home should start focusing on just that.
We gotta focus on the good stories and not constantly beat ourselves over the bad stories. And sometimes we're our own worst enemy. In our quest to sensationalize an event, we damage the destination. So if you think about Mexico and you think about Jamaica, they have far worse crime problems than we do. But they have mastered the art of reporting it, but not sensationalizing it. And that's maybe what we got to focus on.
Now, when it comes to whether there's a real threat at like the fish fry at Arawak Key, the minister said he's frequented the popular hangout, especially in the last few days, and feels it's more a matter of people being nuisances than any real danger.
There's petty crime. There's people taking advantage of foreign visitors, selling them goods that they have no intention of delivering. And so, yes, we need to enhance the police presence on the ground to remove those nuisances. But there's no major crime going on down there. It's more nuisance crime. People taking advantage of foreign visitors in terms of selling them services that they have no intention of delivering and maybe harassing them a little bit. But, in terms of their safety and security, I'm not worried about that.
Regionally, the United States recently slapped a highest-level warning on 5 Mexican states, charging that they are hotspots of drug cartel activity, either hosting trafficking routes or extensive drug crop cultivation. For JCN News, I'm Jillian Gray.
In other news this evening, Health Minister Dr. Dwayne Sands not running away from claims that doctors in the public healthcare system are overworked, but he's chalked it up to doctors not being deployed for the most benefit of the population. Dr. Sands believes placing well-trained doctors in public clinics and on the family islands changes the approach to wellness. He suggests giving appointments instead of having patients take numbers with no surety of when they'll actually see a doctor. When it comes to changing the model and reworking the system, Dr. Sands says that process has been taking place for a while within their family practice program.
The historical approach to healthcare in the Bahamas has been hospital-centric, right? So you could put a bunch of very good doctors in the hospital, but then you also then have a lot of people coming to the hospital. Maybe a better model is to take the fight for health to the community. So you put your very best doctors into the community clinics, to prevent people from having to go to the hospital. When the pediatricians did that about 10 or 15 years ago, we saw a dramatic change from an overcrowded children's ward to a place where empty beds.
Chairman of the National Health Insurance Authority and renowned physician Dr. Robin Roberts says the country has a way to go in implementing proper working hours, citing international legislation put in place by other countries around the world. The health profession, meantime, mourning the loss of an esteemed colleague, friend, mentor, and giant, Caribbean and British-trained physician Dr. Cecil W.M. Bethel. Dr. Bethel was the first Bahamian to graduate from the University of the West Indies, completing his internship at the public hospital in Georgetown, Guyana, eventually serving as a medical officer at the Princess Margaret Hospital from 1959 to 1962. He went on to become the first medical chief of staff at PMH and also served as senior consultant physician and head of the Department of Medicine. Dr. Bethel's contributions to the growth and development of the medical profession are said to be legendary, having demonstrated the highest standard of medical practice and ethical principles for physicians to follow. The health minister acknowledging in a release that Dr. Bethel always made sure everyone was treated with dignity, fairness, and support. Our final story is up next.
This segment of the news has been brought to you by Sun Oil Limited.